GI, the gastrointestinal system. So what you do is you take 1 teaspoon of each formula in a big bottle of water like this, and you sip it throughout the day. You don't really taste it. It is extracted in alcohol, so if you have a problem with alcohol, what you can do is put it in like a little teacup with boiling water. The boiling water will make the alcohol evaporate, and then pour it into your water. Okay, so it's a 1-month kit, and it will cost in the neighborhood of $40, and that will help to clean your body from inside out. And then while you're doing that, continue to drink lots of water, eating detoxified fruits and vegetables, lots of berries, and you can take detox supplements. And I'm going to go over a very specific type of detox in a little bit when we talk about lab work, which is the heavy metal cleanse. Okay, so back to the principles. The first principle on the board is first do no harm. So what happens with conventional medicine is sometimes people come in to the doctor for one issue, and then they can leave with another issue because the conventional medications often have toxic side effects. And I'm sure you've all been watching TV and you see we're bombarded with drug advertisements. And for example, it could be an advertisement for an antidepressant drug. And the list of side effects is like, okay, if you take this, you might, yeah, exactly. It's horrible. You could do homicide. What's it called when you kill somebody else?
Homicide.
Homicide. What? When you, suicide. Thank you.
No, my favorite is losing. I think that.
Okay. So the side effects of the drug are worse than the problem that it's supposed to treat. So when you see a naturopathic doctor, you're never going to like come in with one problem and leave with another problem, or have the side effects be worse than the treatment itself. For example, the drug that's used to treat toenail fungus, it actually harms the liver. And the liver is a very important organ in the body. It helps to detoxify the body. It also synthesizes hormones. And if you have cirrhosis or liver damage, it cannot function properly. That can be, very detrimental to one's health. I mean, obviously something like a toenail fungus, it's not life-threatening. It's just an aesthetic problem. It's not anything that is going to really harm your health, but it's something that you can live with. So it would be better to do nothing than to take the conventional drug. But in case you're curious, what you can do holistically for that is actually something that's very simple. Vicks Vapor Rub, which is basically just essential oils in like a Vaseline, a petroleum jelly. Why that works is because the Vaseline base helps the essential oils to penetrate. What happens is that the fungus lives underneath the nail. So even tea tree oil and natural antifungals, which are good and effective, they cannot get where they need to go. They cannot penetrate through the nail. But the Vicks Vapor Rub, it helps it to drive the medicine in where it needs to go. So basically what happens is, and I have a colleague who actually, he had cancer and he went through interferon therapy, which totally suppressed his immune system, and he ended up with toenail fungus. And I was shocked when actually his conventional doctor told him about this Vicks Vapor Rub trick, and he did it and it worked. You have to put it on every night, like before you go to sleep, and then put a Band-Aid over it to help it to penetrate so it doesn't like rub off on your socks. And like a month later, the new nail that grows, it starts to grow healthy, and then every time you clip your nail, you clip the diseased part off until eventually the whole nail is clean. So that's just a small example of first do no harm. Okay, the next principle is the healing power of nature, and in Latin, it's vis medicatrix naturae. So whenever possible, we try to use nutrition, herbal medicine, homeopathy, all natural ways of stimulating the healing power of the body to help the person overcome their illness. Naturopathic doctors in licensed states are able to prescribe, like I said before, antibiotics, and it's not like we're opposed to using those conventional medicine. We just use it sparingly, okay? We don't give antibiotics for every little cold that a person has. But definitely, in some cases, it's warranted. For example, if somebody has strep throat, They could take a 10-day course of antibiotics, which is good because it helps the body to heal faster. Or if you do like herbal medicine, it can work, and you'll have to be more like you need to take your herbal medicine like 3 times a day as opposed to the antibiotic once a day. So you have to be more diligent about taking your herbal medicine, and it can take longer. It could take like 3 weeks to heal strep throat if you do it holistically. So nowadays, people don't have patience. They want a magic bullet. They want a quick fix. So a lot of times, they go to conventional drugs. And that could be the same for arthritis or any other condition that we're treating, is that the holistic approach takes a little bit longer before you see the results, but it's a less toxic approach. And we do also, sometimes recommend, for example, surgery, chemotherapy, radiation. It all depends on the individual case. It's not that we're opposed to using conventional medicine when it's necessary. Number 3, discover and treat the cause. So what we want to do is we want to find out why is a person manifesting certain signs and symptoms. What is causing a person to be depressed? For example, it could be hypothyroid. If the person's thyroid is not functioning optimally, it can cause a whole bunch of signs and symptoms. Is that the reason why they're depressed? Could they have heavy metal toxicity? Do they have maybe a deficiency in the amino acid called tryptophan, which is the building block of serotonin, which is the neurotransmitter that's responsible for feelings of well-being? Did something happen to them that traumatized them, when they were a child or even as an adult? Maybe they need psychotherapy, maybe they need something like emotional freedom technique, or, we don't just, I'm sure you've all heard of St. John's wort. That's a very popular herb for depression. But we don't see a person and think, okay, you have depression, here's St. John's wort. No, we need to find out why are they depressed, so then we can give them a therapy that's custom tailored to that person. And not every person who has depression has it for the same reasons. And that's one thing that differentiates us from conventional medical doctors. Deepak Chopra, who is an MD, says that conventional medical schools are funded by big pharma, pharmacological businesses. So, of course, they teach them, okay, you have depression, you give SSRIs, serotonin reuptake inhibitors. And what those do is they prevent the breakdown of serotonin in the body so that you keep having more, the same circulating serotonin, which is totally unnatural because every cell and every neurotransmitter in our body is being formed and broken down all the time. And we don't want to keep stagnant chemicals around in our body. Of course, the SSRIs and other antidepressants also have side effects. Okay, the next one, number 4, treat the whole person. So a lot of times when people come in, they have different things going on. Maybe they have the toenail fungus, maybe they have irritable bowel syndrome, maybe they have depression. Well, we look at the whole person because sometimes all of those different things that they have could all boil down to one imbalance or maybe 2 imbalances. And when you put the person's body in balance and harmony and health and detoxify them, then those problems will alleviate. They will take care of themselves. So we treat the whole person. We don't compartmentalize and send you to the gastrointestinal specialist for your IBS, to the psychiatrist for your depression, to the podiatrist for your foot problem. No, the body is a unit and it functions together. It's a living organism. And we're not like cars that when you go to the mechanic, something breaks down, you fix it. You don't go to, somebody for your transmission and somebody for your oil and somebody for, to paint the car. It's not like that. We help everything together. Number 5 is my favorite principle. Docere means to teach. That's the Latin for physician is a teacher. And back in the day, before medicine started taking on this unfortunate evolution, the way that conventional medicine is going, I'm sure you've been to a regular doctor, you come in, you say, I have this problem, they see you for 5 minutes, they write you a prescription, next. Okay, so back in the day, 200-300 years ago, doctors spent time with their patients and they taught them how to be healthy. And in fact, in China today, doctors are paid when their patients are healthy. So can you imagine if our doctors here were paid when their patients were healthy? Like, we have a lot of rogue doctors, right? Driving around. So teaching is very important, and something that you can expect if you see either an acupuncture physician or a naturopathic doctor, your first visit, you should expect to spend at least an hour with them. Because it's going to be a very thorough intake. They're going to ask you a lot of questions. They want to get to know you, get to know your family history, so they can really find the cause and treat the cause. And then follow-up visits can be anywhere between half an hour and 45 minutes. But it's not like a, wham down, thank you ma'am kind of thing. Okay, and the last principle is prevention is the best cure. They say an ounce of prevention is worth a pound of cure. So if you want to prevent disease, drink lots of water, eat healthy, eat organic, avoid pesticides, preservatives, processed foods, eat fresh, local, organic, and exercise, get good sleep, reduce your stress. That can help you to prevent disease. But of course, we all have genetic predispositions for all kinds of different ailments, whether it's diabetes, cardiovascular disease, cancer. It's already programmed in our genes. But if we do all of the right things, we don't have to manifest those conditions. It's just because somebody has the breast cancer gene, it doesn't mean that they will have breast cancer. That gene has to be flipped on. And what triggers it could be emotional, it could be nutritional, it could be lots of different factors. So that's why we need to make sure that we're in the best health, mind, body, spirit, and we can avoid illnesses, because once you have an illness, it's much harder to get rid of than if you prevent the disease. But many conditions are reversible. Okay, so, are there any questions about naturopathic medicine? Because I'm going to shift into the Oriental medicine. Don't be shy.
What was it? Vicks Vapor?
Vicks Vapor Rub. So basically at CVS or Walgreens, it's a little container like this. It's blue, and it's like Vaseline. You just
And you mix that with
nothing. No. It already has essential oils inside. I think it has menthol, maybe lavender or eucalyptus. So you don't have to mix it. You could add a couple drops of tea tree oil to maybe make it stronger. Maybe you can get rid of it in 15 days instead of a month. But yeah, just by itself. And it's best to do it twice a day. But yeah, because foot funguses are very hard to get rid of once a person has them. And you can get them at community pools or gym locker rooms. It's very good to wear flip-flops. Like I would never recommend showering barefoot in a public place, because those funguses live in wet, humid places, and they're very easy to transfer from one person to another, and they're very hard to get rid of. Yeah. Any other questions? Yes.
What is a legal practice?
Naturopathic medicine. Excellent question. So, I believe it's more of a political thing, because the naturopathic or the conventional doctors don't want us to take away their business, because if we're helping people to heal and they're keeping people sick and they're coming back and they're making money, it is a problem. But we are trying to lobby, but that takes a lot of money, so you have to fundraise, you have to raise like $100,000. I think we have maybe $60,000 so far. And although there is an awareness, I guess the demand isn't that high for it here. And I was actually quite surprised about that, because I'm from California and I moved here in 2006. And I thought, I'll be a big fish in a small pond. I'll be the only naturopath, and there's no naturopaths here, so I'll be busy. No, I was surprised. But I think that it's the more awareness and the more people learn about it and know about it, it's natural that you would want to choose it, right? We don't want toxic side effects and drugs that cause more problems than they're helping. Yes.
As far as cost-wise goes, in the states that naturopath medicine is legal, does insurance?
Yes. Yes, it does cover. Yeah. Many insurances do cover naturopathy in licensed states. Blue Cross Blue Shield, I know, does, like in California, for example. And I'm able to bill PPO insurances with